started. Okay, so I want to thank everybody that's here today. We're welcoming you to our Family Medicine Grand Rounds presentation for today. If you are interested in CME credit, the event code for today is 90047. The phone number and email address are down there. If you have any questions, please feel free to reach out to me and I'll get back to you as quickly as I have on any questions, or I can direct you to the CME office as well. But next slide. And so for today, we want to thank you in advance for muting your microphones if you haven't already. Also being attentive to Dr. Svec's presentation, being engaged, and then also towards the end of the session, I am going to put an evaluation link into the chat box. So if you would please help us and provide feedback for him through that link. And then also he asked for this presentations, any questions you have, if you could put those in the chat box as we go, and we'll take a moment to answer those at the very end. Next slide. So this is the South Texas Regional Family Medicine Grand Rounds, and we are partnered with the South Central Area AHEC, and it is our mission to invent a healthier future for the families and communities in South Texas, San Antonio, and beyond through excellence in patient-centered care, research, and education. If you are interested in the CME that I discussed earlier, you just need to follow the steps. You can view your transcript, but I know if you're having issues, please reach out to me and I will work with the CME office to make sure that you can print that. But if you have questions, you may also give them a call. AAFP credit is also 1 credit for this presentation. And if you have any questions, please feel free to call or email them as well. And so Dr. Svec is presenting for us today. He has no relevant financial interest with commercial interest to disclose. And he is going to present for us today on the primary care for the athlete pre-participation physical evaluation. So I will let Dr. Svec go ahead and get started for us.
All right. So hello, everyone. Dr. Svec, like Nicole said, I'm one of the assistant professor clinical at UT. I'm primarily based at the Hill Country Clinic, and I spend a little bit of time at the Mark. So today we're going to talk about the importance and history of pre-participation evaluations, which we call PPEs. So just like turn off the COVID part of the brain for a little bit. And in this case, I'm talking about pre-participation evaluations and not personal protective equipment. And then we're going to review the important components of it, and then discuss some more of the common like clearance decisions that you may have to make based on things that you find on the PPE. So just quick bit on me. So I did my residency here with UT Health. I did it in family and community medicine. And then from that, I went to across town to Christus and did a fellowship in primary care sports medicine. And through my fellowship, I did team coverage for UIW, Our Lady of the Lake University, and multiple high schools. I spent most of my Friday nights last year with Harlandale High School doing their sideline coverage for their football team. And so got to do a lot of PPEs or sports physicals during my time last year, and some throughout residency as well. So quick history. So PPEs really started like back in the 1890s, and it was in Britain actually, and they were ensuring students could participate in physical activity at school, that they had all the appropriate medical history. And then the US kind of took it over for World War II, and they expanded it because they wanted schools to kind of check and see if people would be suitable to be drafted or if they would be declared unfit for service. And then the American Medical Association called, later, or more recently, the American Medical Association called for youth athlete screening process, which has led to where we are today with the modern PPE. So this is small, but we'll talk about it in sections, so it'll zoom in. But this is a form that most people in Texas are familiar with. This is what's put out by UIL. The first page is typically assisting you with history taking. Usually you want them to fill that out before the visit. Second page is what you fill out at the visit with their vitals and their physical exam, and any decision you make at the bottom there. So next we'll kind of talk about what exactly are the goals of the PPE, because we do them a lot and people come for sports physicals, and they're only as good as we make them. So first, foremost goal, evaluate the general and physical and psychological health of the athlete. And this is important because routine preventative care is recommended for all adolescents, and a lot of adolescents receive no care except for their pre-participation exam. Secondly, determine if they have any life-threatening or disabling conditions. You really can determine that through personal and family history. Some of the common things that you want to rule out: Marfan's or hypertrophic cardiomyopathy or HOCM. In terms of doing regular like EKGs or echocardiograms just as a part of the PPE, there's a lot of controversy there in the US. It's not commonly done. It can be done at the collegiate level depending on the school, but typically most high schools are not going to do it. In Italy, they do it for everyone. So a lot of the data on the utility of it comes out of Italy. Then evaluate for conditions that predispose to injury and illness, such as like previous injuries, previous ankle sprains, knee injuries, those sorts of things, previous concussions. Using it as a time to counsel on lifestyle and health issues, tobacco, alcohol, drugs, nutrition, mental health. And this is especially important if it's a part of their general physical in your office. Harder to do in the group setting, which we'll kind of talk about the two different settings that PPEs are commonly done in shortly. And then also it can serve as an entry point into healthcare for those that don't have a pediatrician or a family medicine physician. So maybe you are volunteering somewhere to do pre-participation exams, and you are able to kind of like, oh, well, maybe you want to follow up with me at my clinic, and that can kind of serve as a point for them to have a regular doctor if they don't have one. And then, so those are all the goals. So when to do it. So ideally, you should do it with their yearly checkup. And that's because typically what happens, that's why I say ideally, is all the parents bring their kids in the summer. And they want to do all the pre-participation exams before the school year starts. But if you notice, even some of the things we talked about so far, like counseling on lifestyle, a lot of that's what we do at adolescent yearly checkup visits anyway. So the PPE can nicely fit into that sort of well child check. And then if it's not done at their yearly checkup, at least 6 weeks prior to the preseason starting. And that's important because it allows for the follow-up work if you need it. So if they come in and they're like, oh, they need to be cleared by next week, like hopefully everything's normal, because then it's hard to say like, oh yeah, he'll be cleared, because how long will it take them to get a echocardiogram or cardiology consult or urology consult, depending on what you find. So, in terms of frequency, there's all sorts of recommendations. So the American Academy of Pediatrics just recommends the comprehensive health visit annually from 6 through 21. American Academy of Family Physicians recommends a preventive health visit every 1 to 3 years for adolescents and young adults. Most adolescents are going to have the yearly. Young adults are probably going to space theirs out. And then the NCAA, the NAIA and NJCAA, they recommend a comprehensive exam by the team physician at the start of their college athletic career, and then kind of abbreviated shorter exams annually, just focusing on any injuries that may have occurred in the prior year or any changes in their medical history. In terms of like, well, is it better if we do it more? We don't really have the evidence to support that yet. So no reason to do it more frequently with our current evidence. So these are the two settings that I mentioned I talk about. So there's office-based and then the group or the station-based. So office-based, that usually is good because it's like if I was doing it as their primary care doctor or their pediatrician was doing it. So it's good continuity of care. You already know their history coming into the physical. Also, it's more private. You know, in an exam room, where in the group and station-based you usually aren't. Disadvantages could take longer. There could be additional costs associated with it. There is kind of an issue, and I'm no billing and coding expert, but it's hard to bill for just a pre-participation exam. And so some offices do count that as more of like a form filling out. And so there could be a form fee associated with it. And that's why it's good to kind of lump it in with their yearly visit, because then it is covered as like a yearly preventative visit. And then also a disadvantage, so there's can be varying experience with primary care physicians just based on how many they saw in their training and whether they've, you know, sought out resources to kind of expand their knowledge there. So the group and station-based, so this is typically what happens. Sometimes school districts or schools will put these on. It'll be like in their gym. Frequently, this is what happens in college, that comprehensive one at the start of college. Usually there are so many days that physicals are scheduled and it's group or station-based. And so they're efficient and they're good for athletes that don't have a primary care doctor. And a lot of times, you know, college athletes are away from their home. So even if they had a primary care doctor, they may not be in the same city anymore. Typically the way they're set up though, so for example, when I was doing these last year at UIW, me and some of the other primary care sports docs covered, you know, the general physical exam except for the musculoskeletal system. And then once they were done with us, then they went to another room and that was ortho docs were there and they covered all the musculoskeletal. So there's not even great continuity of care throughout the exam. And then also it can be noisy if it's in a big gym, and then there can be a lack of privacy. So if any sort of you know, general exam is definitely indicated, then they're likely going to have to be done somewhere else. So components of the exam, nothing too exciting here. Vitals, history, physical exam. Vitals, the usual vitals: height, weight, temperature, pulse, respirations, and blood pressure. Typically on the UIL form for Texas, they also want you to check vision. So, and this is, if it's in an office, it's going to be done by whichever staff typically does your vitals. So medical assistants, nurses. In the group or station-based, it could be MAs, nurses, athletic trainers, med students that are volunteering. If there maybe some other people that are volunteering and they're trained in how to take a blood pressure and all those things. So that role can be filled by multiple people in that situation. So the next is the history, and this is on the UIL form, you know, something that you want them to fill out before. And history is good because I mean, up to 88% of general medical problems and 65 to 75% of musculoskeletal conditions can be detected just from a good history. And so that includes getting their past medical, past injuries, including concussions, family history, especially cardiac, medications, and supplements. A lot of athletes and families may not count like vitamins and supplements that they take as something that they need to report. So that might be something you need to ask about. And then allergies. So, and like I said, this is typically assisted by that pre-exam questionnaire. So these are all the questions. And they're kind of, you know, the question number kind of breaks it up by the category they're focusing on. So the first two is just kind of their general update. All of the section in 3 is where you're trying to figure out if they're at risk for cardiac conditions. 4 turns into kind of checking on concussion history. 5, you want to ask about paired organs. I will say on the UIL form, it doesn't really explain what paired organs are. So you may want to double check that with the parents and just make sure that they did answer that correctly. And then under a doctor's care, any of their prescription medicines, dizzy during or after exercise, common skin problems, so heat illness, trying to get all of those things. Asthma, prior injuries, and then 16, 17, 18, or 16, 17 are kind of mental health questions. Do you want to weigh more or less than you do now? And do you feel stressed out? 18 is because you need to check for sickle cell trait or sickle cell disease, because you can be if it's a high exertion sport, they may not be the best athletes to participate in that. They can be at increased risk of rhabdo or going into crisis. So, and then there's some female and male specific questions, mainly for the GU system. This my favorite part of the UIL form. So if they answer yes to any of those questions, they have this tiny little box to answer in, but hopefully they'll follow the instructions and attach an additional sheet if they need it, to kind of better explain things. Physical exam, and then we'll kind of go by section, but this is what the UIL form asks for. So general appearance, eyes, ears, nose, throat, lymph nodes, heart, you want to listen. 2 positions, UIL prefers lying down and standing. Check their pulses in the lower and upper extremities, lungs, abdomens, genitalia for males, skin, check for any concerns for Marfans, and then the general musculoskeletal exam. So now we're just going to talk about things that we should focus on in each section. So in eyes, ears, nose, and throat, eyes, visual acuity is important, and we'll talk about that when we're on common clearance concerns, pupil reaction. Ears, you want to make sure there's no signs of infection, make sure their tympanic membrane's intact, especially if they're in any sort of water sport, swimming, diving, water polo. Mouth, you want to check for braces, make sure there's no palate abnormalities. Braces, they may need a special mouth guard, especially in contact sports, as that can, increase the risk of mouth injury. Cardiovascular, pulses, auscultation. I put sitting in supine here. The UIL form asks for standing in supine. And then over to the right, we just have I just wanted to highlight some of the murmurs that you don't need to be worried about or you need to be more worried about. So normal is the systolic ejection. It begins after the first and ends before the second, crescendo, decrescendo, or the normal split that adolescents tend to have. Concerning, a diastolic murmur, a holosystolic murmur, continuous murmur, a loud murmur, so greater than or equal to grade 3, or an abnormal split. And those are reasons that you probably want to get an echo. So pulmonary, you're mainly listening to wheezes, listening for wheezes or rubs. And this is more in the history section, but this seemed like a good place to mention it. One thing I've noticed a lot is asking about if they have asthma and they're on a rescue inhaler, making sure that the rescue inhaler isn't expired. A lot of times it can be because maybe they haven't had to use it a lot, so they haven't paid attention to that date. So, sending them a new prescription for an inhaler may help. And then if they are more in like high school, middle school, and not college, making sure that they have an inhaler for at home and at school. For the abdomen, obviously you want them to be lying, check all 4 quadrants. You're looking for tenderness, masses, enlarged liver or spleen. For male, for the genitalia exam, so female, this is not a part of the pre-participation exam. For males, you're checking for an undescended testicular lump, and inguinal hernia. So for a long time, everyone checked for that. The opinions are kind of all over the place on whether you should or shouldn't. One of the things that I just wanted to point out is if it's asymptomatic, that doesn't exclude you from activity. So is it so necessary to check? Maybe not. And that's where people have been leaning recently. But if symptomatic, definitely something you want to check. And this is where the group station exams can be difficult because you don't have the privacy to do this. So skin. So you want to look for infections, scabies, lice, suspicious moles. I put a couple pictures. So the bottom one is showing something called herpes gladiatorium. So it's a herpes skin infection, common in wrestlers, hence the gladiatorum. And then the picture on the right is showing scabies. There's a few rules for contact sports and skin infections. So for bacterial skin infections, they need to have been on treatment for 72 hours and no new lesions in the last 48 hours. If they have tinea corporis, it's 72 hours of treatment before they can be in contact sports. Herpes, they need 120 hours of treatment and no new lesions in 72 hours. And then tinea capitis, they need 2 weeks oral treatment and no new lesions. So those are, you can find those easily, but those are definitely some of the more common skin considerations you may need to know, especially if they, I say it might be unlikely they come in with an infection at their PPE, but if they're following up in your office and they have a skin infection, you know, they're a contact sport athlete, you want to be able to guide them properly. For the musculoskeletal exam, so there's a general exam, which is the picture that I put here. I did realize late, and then I wasn't supposed to change slides, that it was missing the duck walk. So it's this exam plus the duck walk. And so this exam takes about 4 minutes and kind of gives you like a good overall picture of their health. So the first picture, you're just supposed to inspect them standing and they're facing towards you. And you're just looking for symmetry of the extremities, the trunk, and that's mainly it. 2, you're checking the neck. So forward flexion of the neck, extension of the neck, rotation of the neck, and lateral flexion of the neck, or lateral flexion, sorry. 3, shoulder shrug, resisted, because that kind of tells you how their trapezius is. 4, resisted shoulder abduction, checks the strength of the deltoid supraspinatus. What 5 is supposed to be showing you is internal and external rotation, so checking the motion at the shoulder. 6 is supposed to be flexion and extension at the elbow, so checking the motion at the elbow. 7, you have them supinate, pronate, so checking some further motion at the elbow and the wrist. 8, clenching a fist and then spreading the fingers, so you're checking their motion there. 9, you're inspecting with them facing away from you. And so there you want to look at symmetry of the trunk and the back and all that. 10 is back extension. 11 is forward flexion of at the back. And here's where you can also assess for any abnormal curvature or scoliosis. 12, you have them tighten their quads. So you inspect the lower extremity, but also have them tighten their quads and make sure that there's no major difference in quad tone. And then 13 is just standing on your toes, and then standing on your heels. And that's to assess calf strength and motion at the ankle. So, and then the final thing that's missing is duck walk. So it's basically, you go into a deep squat, you have them take 4 steps forward while they're still in the squat. And that assesses, you know, multiple muscles in terms of control and flexion and flexibility. If you search duck walk, it'll definitely come up. So that's the general exam that you can do if they don't have any prior injuries. If on their little form, they've indicated that they have had a prior injury, you may want to do some additional focus on that joint. So inspect and you know, it's the normal physical exam for musculoskeletal inspection, palpation, active and passive range of motion, strength testing, and then any special test for that joint. The other option with musculoskeletal is there's some sport-specific testing that you may want to do. So if you know they're a baseball player, kind of a more in-depth shoulder exam focusing on the internal and external rotation. The little general exam checks just the motion, but you could also check the strength with resisted internal and external rotation. And why that's important is a lot of baseball players, especially those that pitch, end up with shoulder pain. And a lot of times it's poor muscle control at the shoulder. So you're trying to find those deficits early and kind of use the athletic trainer to treat those early in the season so that they're less likely to develop the injuries later on. And then hockey players and ballet dancers are at increased risk for femoral acetabular impingement. So there's a test for that, fader. So flexion adduction, internal rotation at the hip. So basically have them flex at the hip, and then you adduct and internally rotate. And the causes of femoral acetabular impingement are usually cam lesions or pincer lesions. So a cam lesion is an abnormal bump on your neck of your femur. And so that bumping into the labrum at the hip can cause a lot of pain. And then the opposite, pincer, is your hip socket has a little bit of a extra growth on it. And that also can impinge on the labrum, because when the femoral neck comes up and makes contact, it makes contact earlier due to that lesion. Neurologic, so you want to check for history of head trauma, cervical spine injury, or any neurological symptoms at rest or during activity. And that triggers a more detailed neurologic examination. And so cranial nerves, motor and sensory functions, deep tendon reflexes, checking their cognitive function, their cerebellar function. A typical neuro exam will just kind of a lot of it will be included musculoskeletal because strength, and then you want to check at least upper and lower extremity deep tendon reflexes. So last section, we'll go over some of the more common clearance concerns that people have. So probably the top thing that shows up is cardiology. So if you're concerned for hypertrophic cardiomyopathy based on family history, physical exam, those athletes do need to see cardiology for clearance. Don't take that upon yourself. Just refer them to cardiology. Explain to the parents that that's important. Mitral valve prolapse. So if you find that, that's okay, as long as there's no repetitive SVTs or other dysrhythmias, as long as there's no family history of sudden death or history of embolism, or if they have marked mitral regurg in addition to the mitral valve prolapse. And then other dysrhythmias require that they need to be controlled for 6 months, and the athlete has to be asymptomatic before they would be cleared for activity. Wanted to tell y'all about this. So the 36th Bethesda conference, so they update this, I don't know how frequently, but rather frequently. And it goes over basically any concern you could have cardiology wise and what you should do for it. So I was gonna show y'all an example since take advantage of Zoom. So I'm gonna stop this for a second and then I'm gonna pull up the Bethesda. So this is what I was talking about. So this is the document. So this specific section is on congenital heart disease. So for example, you'll see here, atrial septal defect untreated. And then you can read a little bit about recommendations. So athletes with a small defect, normal right heart volume, and no pulmonary hypertension can participate in all sports. If they have a large ASD, but normal pressure, they can participate in all sports. If they have ASD and mild pulmonary hypertension, they can only participate in low intensity competitive sports. And this document will spell all that out for you. So in terms of like resources I wanted to share with y'all, this was one of them. If you Google 36 Bethesda, it comes up and it's free to view. It is a lot of pages. I was trying to find 64 pages. So let me switch back. All right, so then next, another common thing, Marfan syndrome. So this is the diagnostic criteria for Marfan syndrome. I just pulled it from the Marfan Foundation. So in the absence of family history, an aortic root dilation, Z-score greater than 2, and the lens abnormality is Marfan, aortic root dilation or the mutation is Marfan, aortic root dilation, and a systemic score of greater than 7 is Marfan, and the lens abnormality and the mutation associated with aortic root dilation, even if they don't have the aortic root dilation, is Marfan's. If they have a family history, it's a little less restrictive. But yeah, this kind of goes all over that. And if they have Marfans, it disqualifies them from all competitive sports because the risk is just too great. So the lens dislocation, the aorta can be dilated. So there's just too many risks associated with it to allow them to go forward with any competitive sports. You're obviously not going to be able to tell them not to do things on their own recreationally, but you probably want to strongly counsel against it. High blood pressure, another common concern. So, there's kind of two criteria that we determine whether children have high blood pressure or not. So age 1 to less than 13, they use the normogram to determine. And so if they're within stage 2, based on that, they have to be adequately controlled before they can be cleared. Children greater than 13, it's kind of similar to what we use for adults. So stage 2 is greater than 140/90. So in that case, those are also disqualified until they have adequate control. Single paired organ. So these are one of the things that they especially like to test on the sports medicine boards. So a single testicle, you need to counsel them on a possible loss of fertility and require use of protective cup during contact sports. And that's because if anything happens to that testicle from those from participating in sports, they don't have another, so they may completely lose their fertility and really have to require the use of a protective cup. A single kidney, you counsel on the risk, and they're okay for contact sports unless it's polycystic or in an abnormal location. And so typically, you're going to need imaging to determine that. There are some protective pads and equipment depending on the sport that you can use to protect your single kidney, but you don't disqualify them if it's in a normal location. Vision, so this is why the vision screening is important at the beginning. So if they only have one functional eye, so vision is less than 20/40 with correction, they need to be referred to ophthalmology, and they can only participate in sports that allow the use of eye protection because they're basically at risk for blindness if anything happens to the good eye. And then wrestling, boxing, and martial arts are all not allowed. So if that's the sport they want to play, you have to have the conversation that you cannot clear them for that. For musculoskeletal injuries, so if it's a joint, you can clear them if there's no effusion, no reduced range of motion, no symptomatic ligament instability. So some people with a prior injury, they're going to continue to have ligamentous instability, but as long as they're not having pain due to the instability, it's okay. And then they need to have 80 to 90% of their normal strength in order to be cleared. So, prior knee injury, ankle injury, shoulder, elbow, those are the things that you want to look for. If it's a spine injury, I would refer them to neurosurgery or orthopedic spine specialists for clearing. In terms of like spondylolisthesis, those sorts of things, you just don't want to risk, further injury. And referring to people is not always bad. So this is one of the sections where you definitely want to take advantage of your referrals. Okay, that was fast. So we're at the end. So just a quick summary, and then I can answer questions. I'll look through the chat for them. So pre-participation exams, obviously, they serve as our screening tool for athletes. They're kind of, like I said, they're only as good as we make them out to be. If we rush through and don't take the time to get a good history, do a thorough exam, then we may miss things. And, like I said, some adolescents, this is the only yearly checkup they get. And even in the time of COVID, some people haven't had it for a little bit because they've been extended. They're vital history physical exam, just like a typical office visit. And the clearance decisions. I went over a few, but they can vary greatly by medical condition. And then these are my references. And the reason I have this one highlighted over here to the right is this is where I pulled a lot of the information I gave in the presentation from. This is the pre-participation physical evaluation 5th edition. So this is put out by the American Academy of Pediatrics, but all of those other organizations sign on to it. So like ours, the AAFP signs on to it, ACSM and AMSSM, which are two of the big primary care sports medicine organizations, sign on to it, as well as the osteopathic sports med and the orthopedic sports med organizations. So it's not available for free. You have to buy it from the AAP website. They have a hard copy and a PDF version, well, not PDF, but a electronic version. And it goes way more in depth into a lot of the other, like, should I clear this or should I send them there? That information is definitely available there. Also, just a referral to, if you have questions and there's a primary care sports medicine person where you practice, a referral to us is fine for those situations too. And I know we'd be more than happy to figure it out and make sure they're getting back to athletics safely. So, all right, let me pull up the chat.
I was gonna say, I don't see any questions in the chat at the moment. I don't, if anybody wants to put something there, if anybody wants to unmute and ask a question or comment.
Oh, it's the Zoom silence. Well, if anyone thinks of questions, oh, I hear someone talking.
Clearance, how long is that good for? 1 year?
The PPEs? Yeah, so it really depends. So typically they had been good for a year. And talking about this before it started, with COVID, they have allowed some to be good for multiple years. So I think a lot of high school athletes were able to not do one this year. But my thought is coming this summer, they're gonna start enforcing them again, so.
Okay, thank you.
Yeah, this is Byron Hepburn. Ask a quick question for Jeff. What are you seeing here in Texas, being relatively new to Texas, about the use of supplements and protein shakes and creatine and so forth when you're doing your office visits and asking those in-depth type of questions?
So at least out where I am at Hill Country, I don't see it too much. I have had a couple athletes, or not even, I don't know, adolescents really ask me about creatine. I do tend, like the evidence really with creatine is all over the place. So I couldn't give him a straightforward answer, but I did kind of recommend against it because of the theoretical risk of kidney injury. Same thing with too much protein. And a lot of times they're taking more protein than their body's even going to absorb. And so I think it's something like 25 grams is really all you're going to absorb. So people are doing like these 50 and all like these high dose proteins and probably just, excreting it. So.
Yeah, that was my concern in another location, clinical location, where these young men particularly want to get quote unquote big, and their peers are telling them to use these large quantities of protein shakes. So it's something just to be vigilant.
Yeah.
Future physicians, our future family physicians, to be vigilant to that, particularly for the contact sports.
Mm-hmm. Yeah, and I don't see this as much in high school athletes, but young adults, I see testosterone has become such a thing because they just get marketed towards, they all want testosterone checked. And so I've had to do more counseling on testosterone really than any other supplement. So, and usually I tell them, actual reasons to replace testosterone versus the reasons that they want it replaced. Any other questions?
I don't see any others right now, so I guess we'll just go ahead. There is a link for everybody. If you could please help us out and give Dr. Svec some some feedback on today's presentation, but we want to thank you so much for giving us the information today and thank everybody who joined us.
All right. All right. Thank you, everyone.
you.
And
You,
if you think of questions after and you're at UT, you can just search me up in the email system and I'll be happy to answer.